on the web, and in your hands. This is MDiTV.
You may have seen or heard the attention-grabbing headline, "Reduce your chance of having a heart attack by having sex twice a week." Across the country, news outlets carried the story, saying men who make love regularly are up to 45% less likely to have a heart attack. Araujo, a researcher who worked on the study, says he's disappointed the fundamental message was distorted. He says he was surprised by CBS News coverage, and even Jay Leno referred to his study in a monologue.
What else? Oh, a new study just published this week shows that erectile dysfunction can increase your risk of a heart attack by 40%. Well, that should help you get it up, huh, guys? No, if you don't, you're going to have a heart attack!
Leno is referring to a study published in the American Journal of Cardiology. The New England Research Institute studied 1,000 men between the ages of 40 and 70 for 16 years. Each man was questioned about frequency in his sex life and checked for signs of heart disease. Age, weight, blood pressure, and cholesterol levels were also checked. Researchers say their study showed men with a low frequency of sexual activity, intercourse once a month or less, were 45% more likely to develop cardiovascular disease compared to men who had sex 2 or more times a week. However, the researcher Araujo says a prescription for sex was not the intended message. He points out men who engaged in frequent sex are likely to be healthier than others in ways not necessarily captured in our data. The connection of being in a healthy relationship is a possibility recognized in the study, with the benefits of sex contributing to both the physical and emotional effects on the body. Those in the business of counseling couples often point out those benefits.
I mean, there are so many benefits to a healthy sex life. You know, sometimes I think of it like exercise. You know, we know all of the benefits of exercise, and we know all of the things that can do for us. And sex can do some similar things. So it can stretch your muscles. It can release endorphins, which will make you feel good. If you are feeling depressed, if you are somewhere where, the gray months go on for a long time, that's going to help lift your moods and your spirits a little bit as well. It can help you sleep better, give you more energy as well.
When it comes to sex as exercise, there are estimates you burn about 60 calories. So having sex 3 times a week for a year might be considered the equivalent of jogging 75 miles. Other studies outline the physical benefits of frequent sex, including an increase in immunity, a better response to stress, lower blood pressure, lower cholesterol, an increase in estrogen, and improvement in memory. But couples do have to be careful about how they interpret this information and share it with each other.
I'm hesitant to say it will make you live longer, because what happens in relationships where one person wants sex more than the other, they're looking for someone to say, look at all the good things it will do, and can use it to make their partner feel uncomfortable. And I see a lot of couples where there's mismatched desire, mismatched interest in sex. So I would never prescribe that you have to do it, but I will say it can be really, really beneficial.
Jeske says she doesn't know many couples having the twice-a-week sex mentioned in the recent study, and previous studies have defined frequent as once a week. Her advice: don't overreact to the attention-getting headlines and determine your own ideal by talking with your partner. The takeaway message identified by the New England Research Institute is this: sexual health may predict cardiovascular health. Men should consult with their doctors if they're having any difficulties. Also, the screening of men about their sexual activity might be a useful tool for physicians in identifying risk of heart disease. Some of the news coverage also implied researchers felt the results would be the same for women. Araujo says this was not the case. So while the report made for some sexy headlines, in the end, the coverage also gave misleading information about men, sex, and heart disease.